Thank you very much. So I've been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides. Wish it was done a long time ago. Today we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, you know, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000 and 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys. 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all, but if you have to, if you can't tough it out, or if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. Take it over 5 times or 4 times, but you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies, it's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And you know it's artificially induced. It's not like something that, when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it, and that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate, because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, oh, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better, and in some cases maybe substantially better. Not going to be easy, but be a lot easier if it didn't happen in the first place, as these great parents fully understand, right? They fully understand. I feel so terribly for. I have so many friends with autistic children. It's a tough situation. Finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, you know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on this subject for a long time. You know, life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up, and this group has worked so hard on it, but I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. So I just want to say acetaminophen is basically Tylenol, essentially, because I noticed that term is used throughout this conference. So it's essentially Tylenol. And I just recommend strongly that you don't use Tylenol unless it's absolutely necessary. I understand it's maybe 10% of the women that are pregnant are, would perhaps be forced to use it. And that would mean you just can't tough it out. No matter what you do, you can't tough it out. So that's up to you and your doctor. But there's a very strong recommendation, maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's just fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Other things that we recommend, or certainly I do anyway, is, and it's so important to me, to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. And certain things I think you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that pumped into a body? And there were rumors about both of them for a long time. But we're having them taken out. We're having them taken out of the vaccines. Hepatitis B, again, that's sexually transmitted, and we think you should wait. I think you should wait till 12. You know, I'm making these statements from me. I'm not making them from these doctors, because when they talk about, different results, different studies, I talk about a lot of common sense, and they have that too. They have that too, a lot. But I recommend the hepatitis B. Take it at 12. sexually transmitted. You don't have to give it to the baby when the baby's 2 years old. And there are a lot of theories on that, but not when they're 12. Doesn't seem to be a problem at all. The MMR and the chickenpox. Chickenpox has already been broken out. It's a singular shot, but the MMR is not. And I've heard for years that there's a problem with it, but they say that there's no problem if you do each shot separately, not put together. So an MMR, go out and do it separately. Don't take Tylenol. Don't give Tylenol to the baby after the baby's born. Every time the baby gets a shot, the baby gets a shot. They say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol. Now, Tylenol is fine for people that aren't pregnant, that aren't in the situation that we're talking about. One very specific situation. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't do it. Break up your visits to the doctors. Break them up. Do it in 5 if you can. Now, it's inconvenient. It's inconvenient. Oh, you're going to have to go back another year later. You're going to go back each year for 4 years, 5 years, 3 years. Just break it up. Break it up, because it's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it, it's like 80 different vaccines and beyond vaccines, and 80. And you give that to a little kid. I mean, I can tell you that I had a woman who worked for me, a beautiful, wonderful woman, worked in Trump Tower, and she had the most perfect child. Beautiful, just perfect. And I remember this little blonde-haired boy running around the lobby of Trump Tower, so healthy and so vibrant. And I said, that's great. One day I came in and she was crying her eyes out behind the counter. She worked at the front desk. She was crying her eyes out. I've never, as much as I've ever seen anyone distraught, she was. I said, are you okay? What happened? My boy, I've lost my boy. What does that mean, your boy? My boy, you know him, sir. You've seen him grow up. He was so beautiful. And I took him for a vaccine, sir. And he developed this unbelievable, I think she said 107, 108. You know, it goes well beyond when this happens. It goes up to 106, 107, 108. You know, we hear 105 and you're in trouble, but it just goes up to a level that you never hear about, but it goes up very high. And it's fried. They get fried. She said, I took him, he developed an unbelievable temperature. And I've lost him, sir. He's gone. And then I saw the boy. It was so tragic to see. That was the following day. That was the following day after the vaccine. And I've seen it 2 other times, and I think 3 other times, but 2 other times, where they go to the doctor and they get the vaccine, they get the shot. The kid is, badly hurt. Let's be nice, badly hurt. And just do it. Break it up into 5, break it up into 4, break it up into 3 if you have to, but go to the doctor 4 times instead of once, or 5 times instead of once. And for some reason, they insist that you put it all into the body, and maybe that's the drug companies that make more money that way. Maybe it's the doctors because they don't want to be, doing this so much. Maybe it's the doctors. They get maybe more money. Who the hell knows what it is? Don't do it. Get them broken into 4 or 5 visits. Do it 4 or 5. That means you have 20%, 25% what you're putting into the baby's body. It can only help. It can only help. And the other things I told you about, just the word tough it out. It's easy for me to say tough it out, but sometimes in life with a lot of other things you have to tough it out also. Don't take Tylenol. Don't give Tylenol to the baby. When the baby's born, they throw it at you. Here, give them a couple of Tylenol. They give them a shot. They give them a vaccine. And every time they give them a vaccine, they're throwing Tylenol. And some of these babies, They're long born, and all of a sudden they're gone. And it doesn't hurt not to do it. It doesn't hurt. There's no downside. There's no downside at all. And break up MMR. Break it up. It's practically a known fact that if you break it up, you're not going to have a problem. But for years, we've been hearing how bad MMR is as a combination. And I'm very happy that you broke out chickenpox, because that was really a problem. And there are other things. It's interesting because there are other things, we were talking about it, other different drugs, pills that you take that we know are so bad and they don't take them anymore. But for some reason, with this, they keep taking it. Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe. But don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. And you know, we have more than 3 years left. And I told Bobby and the doctors behind me, and they are so committed to this, I told them that this is the #1 thing I want to do from you. And you know, we have something else called Favored Nations, where I'm going to be reducing drug prices by 1,000%, by 900, 600, 500, 1,200. We're going to be reducing drug prices at levels never seen. It's called Favored Nations. We're going to be paying what right now, we're like the garbage can for the rest of the world, and we have been for forever. We pay much higher for drugs than the rest of the world. We subsidize the rest of the world. We're not doing that anymore. And that's a big thing. That's a big thing. That's bigger than anything. I told the story the other night that I was so proud in my first term that for the final year, drug prices went down 0.25%. And I was so proud. I said, why? I'm the first one to do it. I think it was 28 years, they said, where drug prices went down from the beginning of the term to the end. And I was so proud. I called a news conference. I said, you know, drug prices have gone down. First time it's happened in 28 years. You know what it was? 0.25%. I was so proud. Now we're going to have them go down from $100 a pill to $9 a pill. From $1,300 for a shot of like an Ozempic or the fat, I call it the fat pill or the fat drug. Sometimes it works, I guess, for people. The ones I've seen, it hasn't worked so well. I got a lot of friends, they're fat. They said, yeah, I lost some weight. I said, you don't look it to me. But they paid $1,300, $1,200, and they go to London and they pay $88. And they call me, they go, what's this all about? We're subsidizing the rest of the world stupidly because there are a lot of stupid people in this country running things. And how big is that? But to me, that's nothing compared to autism. I see that gorgeous boy. I have a big present for him in the back. You know, you bring him back. We're going to bring him into the Oval Office. I have the best present he's ever going to get, okay? A big one. I saved it for you, okay? Because I heard you were coming. Look how beautiful he is. So that's it. There's nothing much to say. Don't take Tylenol if you're pregnant, and don't give Tylenol to your child when he's born or she's born. Don't give it. Just don't give it. And we're going to have, I think, really, if you do all the things that I say, break it up, just break it up, break up the shots with the doctor. MMRs, as I told you, separate, separate, separate. Chickenpox already separate. You do these things. I'm telling you, I want to, when I leave office, I don't want to have, it's going to be the kind of number that we're hearing, where it's 1 in 32 or 1 in 10, because I've heard 1 in 10 also. And in California, it's really bad. I want it to be, let's get it back to maybe 1 in 10,000 or 1 in 20,000 or maybe none in 20,000. And the only way you're going to do that, because this is artificially induced. This is induced by something. You don't go from 1 in 20,000 to 1 in 10,000, then to 1 in 10. That means you're taking something and something's wrong. And I feel very certain, and I know I'll be criticized. Someday they'll look back and they'll say, well, it wasn't, but I think it will. I think we're going to have a tremendous, this is one of the most, this is the most important thing. There's nothing more important than me. We cured inflation that Biden gave us. He gave us so much inflation, the biggest ever in history. We got inflation done. We brought prices down. We gave you the largest tax cuts. All that stuff, it doesn't mean a thing compared to what we're doing today. This means everything. So we're going to save a lot of children from a tough life, really tough life. We're going to save a lot of parents from a tough life. Okay, how about a few questions? Let's just make it on this subject. This is so beyond as a subject that I'd rather not talk about, you know, some nonsense on the economy. And I will say this, the economy is unbelievable. The stock market just hit another record high and all that stuff. This means more to me. Yeah, please.
Mr. President, I have one on your announcement, one on vaccines that's also related.
Yes.
Why do you think we haven't heard more previously about the tie to autism and acetaminophen?
Nobody knows. I don't know. Not only that, when you say it, you get attacked. I was saying something similar, not as strongly, because now facts are on our side. But I was saying it with Bobby 20 years ago, and I was attacked. I said, whoa, what was that all about? I had no idea. You get attacked. I don't know. The medical community, the drug companies, doctors. I don't know what it is. All I want to do, I don't care. I don't care about being attacked. It doesn't matter to me. I believe that the numbers at the end of our term or shortly thereafter could be really phenomenal. I want it to go up, just like it came down to this horrible level. 1 in 10, 1 in 12. I was told 1 in 10. I was told 1 in 12. Today I heard 1 in 31 if you add the girls and the boys together. It's crazy. And it was 1 in 10,000 and 1 in 20,000. It's not even sustainable for a country. You want to know the truth. And there are other places that don't have it. And they have things in common. And that's called medical research.